औज़ बिल्लाहि मिनश शैतानिर रजीम, बिस्मिल्लाहिर रहमानिर रहीम। व्यूअर्स, आप देख रहे हैं वॉइस ऑफ टोरंटो टेलीविज़न की लाइव ब्रॉडकास्ट। मैं हूं आपका होस्ट अंजुम मलिक। अ वेरी हैप्पी फ्राइडे टू एवरीबॉडी एंड होप एवरीबॉडी इज़ डूइंग वेल। वॉइस ऑफ टोरंटो टेलीविज़न आप सारे डिजिटल चैनल्स पे देखते हैं और IPTVs पे देखते हैं, और हमारा और आपका साथ रहता है मंडे टू फ्राइडे डिफरेंट प्रोग्राम्स के साथ। और आपका फीडबैक मुझे मिलता रहता है, आपके मैसेजेस आते रहते हैं। आपकी मोहब्बत का और आपके मैसेजेस का बहुत शुक्रिया, और आपकी बहुत सारी रिकमेंडेशंस भी मुझे मिलती रहती हैं, और उस पर मैं कोशिश भी करता रहता हूँ कि उस हवाले से हम काम भी करें और बहुत सारे कंटेंट जो होता है उसके ऊपर हम बात भी करें। ख़ास तौर पे आज का जो कंटेंट है उस हवाले से मुझसे रिक्वेस्ट भी की गई थी। हालांकि करंट अफेयर के प्रोग्राम्स में मैं मेडिसिन पे बात नहीं करता, बट आई थॉट इट बी ग्रेट आइडिया टू टॉक अबाउट दिस टुनाइट बिकॉज दिस इज़ वेरी वेरी इंपॉर्टेंट। हमारी ज़िंदगियों में बहुत सारी चीज़ें चल रही होती हैं, हम अपनी ज़िंदगी में बहुत बिज़ी होते हैं, लेकिन हम अपनी सेहत के बारे में बहुत सारी चीज़ों को नहीं समझ पाते, नहीं जानते, या प्रॉपर्ली उसको डायग्नोस नहीं कर पाते, या हमारे जो हमारे फिजिशियंस होते हैं वो प्रॉपर्ली उनको मिटिगेट नहीं कर पाते, और आपको पता नहीं चलता कि आपके साथ क्या हो रहा है। And it has happened to me, and I have gone through that situation where I learned about my health, my life, my situations in a much different perspective than it was before. And it was alarming to me at one stage when I found out, because physicians jo hain, the cardiologists and neurologists, sometimes they say everything is fine, you don't need to do anything. You just follow your proper diet and look after your weight, and everything will be fine, and you are not a smoker, you don't drink, you don't smoke, you don't drink coffee. But हमारी ज़िंदगी के अंदर बहुत सारी चीज़ें ऐसी चल रही होती हैं टाइम टू टाइम जिसका कि हमें इल्म नहीं होता, और जब तक कि वो प्रॉपरली इन्वेस्टिगेट ना हो तब तक उनकी रूट कॉज तक पहुंचना बड़ा मुश्किल है। समटाइम इट इज़ टू लेट बिकॉज समटाइम यू डोंट सर्वाइव, and you may not even know, your family will not even know what has happened to you and why did you left the world. Because अगर आप उसकी इन्वेस्टिगेशन करवा लेते, अगर आप उसको उस सिम्टम्स को अगर आप प्रॉपरली डायग्नोस्टिक उसका हो जाता तो थिंग्स कुड हैव गॉन बेटर। ख़ास तौर पे आज का जो प्रोग्राम है वो एक बड़े हमारे एक डॉक्टर साहब हैं जो कि बड़े लर्नर डॉक्टर हैं, कैलगरी अल्बर्टा से। He is the founding president of EPIC, जो कि ऑल पाकिस्तानी फिजिशियंस एसोसिएशन इन कैनेडा है, डॉक्टर अशफाक शुएब। मैंने आज उनको कैलगरी से दावत दी है टू जॉइन मी ऑन माई लाइव ब्रॉडकास्ट, एंड वी कैन टॉक अबाउट हिज allocates in life and his journey into the medicine, and at the same time all his expertise in research. He has done work in Qatar in the neurosciences. He is working in Saudi Arabia with the institutes there. He has been in Pakistan, now he's in Canada for so many years. So much he has done, he have achieved that Voice of Toronto Television पे हमारी कोशिश ये होती है कि we bring the best out there who can come on this platform, who can interact with us, and who can share their knowledge and their wisdom on this television channel, ताकि अगर हमारी इस एक ट्रांसमिशन से we can save one life, it is worthwhile. So this is very very important that tonight's show, you watch it, you subscribe to the channel on social media, on IP, wherever you are. You can send us a message, you can call us during the live broadcast at 519-923-5220 is our studio line number. 519-923-5220. This is a number to call and be a part of this program. If you have a question, if you have someone who is suffering and you need some sort of a help, you need a second opinion, maybe you just don't know how you need to do a proper diagnostic, then this is very very important for you to watch this show and be a part of this program. I think Dr. Saab have joined us from Calgary with us. He's with us. We're going to take this moment and we're going to welcome him on this live broadcast on Voice of Toronto Television. Assalamu alaikum, Dr. Saab. Thank you so much for joining us from Calgary, Alberta. I really appreciate that.
Wa alaikum assalam. Just a bit of a correction. I'm in Edmonton.
Oh, you are in Edmonton. Okay. I'm so sorry. That's okay. That's okay. Alberta is Alberta. You could be traveling from Calgary or Edmonton, wherever you are. But thank you so much for joining me on this live broadcast tonight. I was just, in my opening statement, I was just mentioning one line, and that was that sometimes we just don't know what is happening to us in our lives, even though we feel we are healthy, we are walking, we are eating, we're doing exercise, but sometimes there's so much going on inside us. And even sometimes, the physicians tell you that, if your tests are fine, your stress test is okay, your echo was fine, even your nuclear test comes out, okay, everything should be okay with you. But, and I was just saying that, on camera, that I when I did further testing, I found out to be not true, and something did came out which I had to mitigate, which I had to manage, and alhamdulillah, it's been dealt with. بٹ میں سب سے پہلے تو یہ چاہوں گا ڈاکٹر صاحب کہ آپ کی تو جرنی بڑی لمبی ہے, فرام یو بین ان ریسرچ, یو بین نیورولوجی, یو لک آفٹر سو مینی تھنگز ان دا اسٹروک فاؤنڈیشنز around the world, and your allocates that you have all these lives. میں سمپلی آپ سے ایک جو کوشچن پوچھنا چاہتا ہوں وہ یہ ہے کہ before we dive deep into the questions and into a lot of more information from you tonight, that what are the early signs for someone to know that he is experiencing a stroke if he is not near to a physician or a hospital and he's at home and he has no knowledge of a stroke, that what could happen to someone or the family members? ڈاکٹر صاحب کیا کرنا چاہیے؟
So, thank you very much for inviting me. I am honored to be on your program.
Thank you, sir. Thank you.
Yes, that's an excellent question. So what has happened, and I'll speak in the context of Greater Toronto, Mississauga, that region. You have 5 major hospitals that are all what we call stroke designate hospitals.
Gee.
So if you are having symptoms, and I'll go into them in a moment, and you call 911, they've all been trained all across the country, and we've been part of that training, is that we have bypass pathways. So we bypass hospitals that cannot manage an acute stroke. Because every minute that we lose, jab tak wo treatment ke liye, every minute that we lose approximately 2 million brain cells. So it's absolutely essential that you call 911 and not jump into a car and take your family member, because that delays everything.
Mm-hmm.
So the word stroke comes from as if you've been struck by lightning. Just remember that part.
Mm-hmm.
It happens suddenly.
Yeah.
If the symptoms are there and they are slowly increasing, that's not a stroke. But if you are having your dinner and all of a sudden one arm stops working, you just drop, or you suddenly are unable to speak, or you have the most severe vertigo or the most severe headache that you've ever experienced.
Mm-hmm.
Those are the key symptoms. They have to be, they are sudden, and it's a loss of function. Because when you interrupt the blood flow to a part of the brain, the brain part immediately stops working. So what we've done, and we've been doing this for the last 30 years now, is that our goal is that the ambulance would call, whether it's St. Mike Hospital or the Trillium Hospital, mm-hmm. or the Toronto Western Hospital, they will notify them. And the hospital notifies the stroke team. So it's almost the same way that the cardiologist is activated if you have chest pain. So from then on, we take over. At the University Hospital here in Edmonton, our stroke fellow would be waiting to assess the patient, and we don't give them more than 5 minutes to assess. Then you scan them to make sure it's not a hemorrhage, because the treatment of hemorrhage is very different than the treatment for a blocked artery. So you scan them, you confirm what the etiology is, and then we start the treatment. And the treatments have just revolutionized in the last 20 to 25 years. And we are working in Pakistan also. So all across Pakistan now, the treatment, which is very expensive, it's $2,500 से $3,000 price है उसकी. So in Karachi, in Multan, in Lahore, in Islamabad, in Peshawar, now in the last year, the government hospitals would give that treatment free of cost. Big achievement. I got to praise them for it.
अच्छा डॉक्टर साहब मैं आपको let me just take you back for a minute. आपने थोड़े से सिम्टम बता दिए हैं कि if this is what somebody is feeling. बट मेरा आपसे क्वेश्चन जो है रिलेटेड टू दिस बड़ा इंपॉर्टेंटली ये है, जब आप अपनी फैमिली डॉक्टर के पास जाते हैं, आपका ईसीजी होता है नॉर्मल है, आपका स्ट्रेस टेस्ट हुआ नॉर्मल है, आपका एको हुआ भी नॉर्मल है, हाउ वुड समबडी वुड नो कि उनकी ब्लॉकेजेस हैं अनलेस दे गो फॉर एन एंजियोग्राफी दैट पर्टिकुलर टेस्ट. और हमारे आई हेट टू से दिस, हमारे जो डॉक्टर्स हैं, जो फैमिली डॉक्टर्स हैं, दे डू नॉट गेट टू दैट लाइन एट द इन द बिगिनिंग कि भाई इस सारी चीज़ों को छोड़ें और आप जाके ये टेस्ट करवाएं, लेट्स फाइंड आउट इफ़ देयर इज़ अ ब्लॉकेज, मे बी ये नर्व्स आपकी जो हैं ब्लॉकेज हैं उसमें नैरोइंग ऑफ द आर्टरी है या व्हाट डू यू से अबाउट दैट?
So Anjum sir, as they say, it's complicated. If you pick up, I'll turn 70 this year. If you pick up individuals who are in their 60s and 70s, and you do an angiogram, more than 50% of us would have some degree of blockage.
ठीक है.
Then the question comes up, what do you do with that blockage?
Right.
So let me just take you back a little bit. So what are the facts? The facts are that those of us who come from Southeast Asia, we have twice the risk of heart attacks and strokes than the Caucasian population. So in fact, being a Southeast Asian, Pakistani, Indian, Bangladeshi, is considered to be a risk factor for heart disease and stroke.
Okay.
And the problem is very, very interesting. I do a lot of teaching. And what I teach is, if you want to take a term home with you, it's called chronic subacute inflammation.
Okay.
Chronic subacute inflammation.
Okay.
That actually starts when you're in your 20s and 30s. So, we all feel that hum to jawan hai abhi na. We can do anything we want to do.
Correct.
So we eat the horrible food that we eat. All our food is processed food. Whether it's pakoras or samosas, or whether it's McDonald's or shawarmas, all of that is processed food. So that's where it starts. So genetically,
so slowly the plaque is developing in your arteries over time.
Yeah. So by the time you have diabetes, and by the time you have hypertension, and by the time you are worried about whether my arteries are blocked or not, which is 2 or 3 decades later, the damage has already started.
Correct.
So if you, and I'm going to intentionally bring you into prevention side. So what do I do? I mean, I think breakfast is the most important meal.
Dr. Saab, we have a call. Can we take a call?
All right. Okay.
Ji, thank you for calling Voice of Toronto TV. Hello.
Hello. Hi, Ji. Is Dr. Ashfaq available? I want to
Yeah, he's listening. He is listening. Go ahead.
Okay. So I have a question regarding heart strokes and heart attacks. Basically, he's telling that it's the young generation, they also are having these heart issues. But what could be the reason that in Asian population it's going on more? Is that the food intake, or is that the more use of meat, like more we are eating more meat eaters, so that's why the reason is? And secondly, what is the stunt that they use for surgeries, like what that procedure is?
Okay, thank you for the call. Watch the show and you will get the answer. Thank you so much.
Would you like me to answer it now?
Yeah, go ahead, sir.
So yeah, I think your question is what I was trying to get at right now. What I wanted to say was the most important meal of your day is your breakfast. All of us tend to just grab a cookie, एक बस बिस्किट ले लेते हैं, and have a cup of tea, and that's the worst thing you can do.
Right.
Because you're going to increase your risk of pre-diabetes with that.
Okay.
So breakfast is your main meal. Don't eat white bread. Eat whole bread and put some, the best thing is either peanut butter or I like almond butter myself. So whole wheat almond butter.
That's nice.
And you can eat an egg also, by the way. It's much better than taking that biscuit and going home. The Heart and Stroke Foundation in Canada and in all over the world, they've identified there's 4 or 5 basic types of food that we eat. The most healthy of the foods is uncooked vegetables and fruits. If you're going to eat cooked meals, the best is lentils. Lentils carry all the proteins that you need. So dal ho gaya, chole ho gaye, and chickpeas, and all of those, right? And if you have to eat meat, eat either fish, oily fish, salmon type ki fish, or you can have chicken sometimes too. But that's what you want to do. And you want to exercise. That's so important. Abhi, it's 7:15 my time, 7:30. I spent an hour in the gym before I came here. Good. I spent half an hour on the elliptical, and I spent about half an hour on what we call cardiac or resistance exercises. And you've got to do that. Because we are at high risk as Asians, and we've got to make this our everyday routine. So 4 to 5 times a week.
Got it.
To do that.
Got it. Let's dive deep a little bit in more very important questions that I have in my mind to ask you. And this is going to be very beneficial for our viewers on Voice of Toronto Television tonight. And I'm sure a life change tonight with information and the guidance and the wisdom that you carry with all these years of medicine, it should come out, someone will benefit from this for sure. The first question that I have for you, Dr. Saab, and this is very important. During pandemic, we all got the shots. Now, since you are also in research, do you think there is any substance clarification that people who got the COVID shots, they have got some of this from the medicine of the COVID shots in their body, and now they have this kind of a problems which they never had before? Have you any research on that?
Yes, I have a few papers on the subject. No, the short answer is no.
Okay.
We are actually the apples and oranges, because when you take a COVID shot, you're either lessening the effect of the virus on your body or preventing it completely.
Okay. So it was a prevention, basically. Okay.
Yeah, very rarely some people may develop myocarditis as a very uncommon complications. But the conspiracy theorists always talk about those.
Okay, no, well said.
I take it regularly.
Thank you for that. Okay, something related to the same question is, how would someone with, for example, that they have not done angiograms, and generally they feel they are fine, but they have low blood pressures or maybe high blood pressures at some times, and they are not properly monitoring it, they're getting dizzy spells, they're getting vertigos. What do people need to do? What people need to focus on, that how to get to the root of that problem by getting properly evaluated?
Yeah, well, it's a very good question, and it's a very common problem. So it just goes back to healthy eating and exercise. That's the most important part. But still, some people would end up having diabetes, or may have heart disease, or have kidney disease. All of these can increase your risk of hypertension. And the medications that you take for high blood pressure can cause fluctuations and make you dizzy also. Dizziness has multiple causes. The common ones are either from your inner ear, so you got to make sure that your ear is fine. Or if it's postural dizziness, so you're lying down, you're fine, you stand up, and suddenly as you stand up, you start feeling dizzy.
Right.
That may mean that your blood pressure is fluctuating. So your family doctor needs to know about that. I am being very careful intentionally, not recommending that you do tests. Because what happens in our clinic, we see about 2,400 patients in our stroke prevention clinic. Somebody would have an ultrasound of their neck for their thyroid. And then they have 60% stenosis of their main artery to the brain. And now they're preoccupied with this. Okay, what are we going to do with this? Turns out that if you eat healthy, exercise, your cholesterol is fine, your blood pressure is okay, then the risk of stroke is about 1% a year for that 60-70% stenosis. And the treatment itself, which is either surgery, we call it endarterectomy, or if you put a stent in there, that carries the same amount of risk also. So the risk benefit, we only get excited about it if somebody has symptoms. We call them transient ischemic attacks. So and that's a very important thing. Let me just draw your attention to it, because people ignore that. So what happens is that you have a 1 to 5 minute episode where you certainly could not speak, or you lose vision in one eye, or your arm is weak. So, and then you get better. So people usually think, bas bala thi tal gayi. But that is where we start investigation. So all those investigations you're talking about, whether you do an ultrasound or an angiogram, or you look at the heart or do a stress test, those tests start if you have any of those warning symptoms.
डॉक्टर साहब, मेरा यहाँ पर एक क्वेश्चन आपसे ये है, अभी आपने बताया कि even if you have 60% stenosis, अगर narrowing of the artery है, but anybody who is going through that, and I'm a witness of this myself, you know, everything changes for you. Your lifestyle change. You can't do sports properly. You are very cautious when you're driving. You can't do things that you would like to do. So मैं आपसे इसलिए पूछ रहा हूँ कि if somebody does have, let's say, that 60% blockage, वो तो उसको उसी वक्त पता चलेगी ना जब उसका फिजिशियन उसको लिख के देगा कि भाई आप जाएं कार्डियोलॉजिस्ट से मिलें, और कार्डियोलॉजिस्ट फिर उसके टेस्ट करवाएं, और फिर वो उनको एंजियोग्राम करवाएं, and then this is how you find out. Otherwise you won't be able to know that there is a problem. I'm just trying to understand the analogy.
Yeah, I'm trying to make a distinction between where I work. So I work from the neck up.
Ji.
In the arteries in the neck, if there is a 60% stenosis and it is asymptomatic, then do everything that you want to do.
थोड़ा सा जरा इसको elaborate कर दीजिएगा, symptomatic और asymptomatic में फ़र्क क्या है?
So, thank you. So, symptomatic would mean that you either have had a stroke or you've had those warnings that I was just talking about.
अच्छा, पहले, okay.
Yeah, let's assume that you were sitting at home, you're having your coffee, and the cup drops, and 2 minutes later, your arm is fine.
ठीक है.
If you go to your doctor would then always investigate you. That's how we've trained over the last 40 years since I've been in medical school curriculums. And then if you, on that ultrasound or on the angiogram, find 60% stenosis, 70% stenosis, we immediately bring you into hospital, immediately meaning the next week or 10 days, and we either put a stent in or we do surgery to clean that plaque out. On the other hand, asymptomatic means that you have had no such symptoms.
ठीक है.
And
all of a sudden it happened.
But nothing has happened.
Okay. You had no symptoms at all. ठीक है.
Yeah, you have no symptoms, and you do an ultrasound for a totally unrelated reason. Thyroid के लिए लोग अक्सर करते हैं. And that shows you that there's a 60% stenosis. I'm talking about that individual.
Okay.
This is a warning that your arteries are hardening. So do all those preventative things, exercise, eat healthy, blood pressure control, all those things. But we don't touch that artery.
अच्छा. जैसे आप नेक से ऊपर देखते हैं, so cerebral palsy, Bell palsy, इस पे थोड़ी सी रोशनी डालें. बहुत सारे लोगों को इस चीज़ का इल्म नहीं है कि ये क्या चीज़ होती है.
Yes,
some people have experience through that also.
Yeah, we call them copycats, or stroke mimics. That's the word we use, mimics. And I've done a few publications on it. We've got to recognize those things. So in the emergency, somebody comes in certain face weakness, or dawaii to hamare paas ready hoti hai. So we try to teach them that there is a differential diagnosis. Sometimes the facial weakness can be from a viral involvement of the what's called the facial nerve behind the ear, and that's a benign condition. Usually it stays for a few weeks and then clears up. Sometimes you don't get a full recovery, but it has nothing to do with your arteries.
Okay.
Similarly, in
So
migraine,
that's something to do with your ear, basically.
there's something to do with the nerve that's coming out behind your ear,
Got
and then it kind
तो
of
अगर
comes out
आपको
like this.
बेल सुनाई देती हैं, you feel
Oh yeah,
windmill sounds in your
yeah,
ears or
yeah,
whistles and all
yeah,
those kind of things,
yeah,
then you need to
right.
see an ENT specialist quickly.
Yeah, usually if you're in doubt, just go to the emergency,
ठीक है.
and the emergency can work. It's better. Who chest pain में बोलते हैं ना कि about half the chest pain is not cardiac, but it's still better to go to the hospital to make sure it's not cardiac
ठीक है.
than to think it's not and miss a heart attack.
ठीक है. ठीक है. अच्छा, मैं चाहूँगा कि थोड़ा सा सर्टन टिप्स जो हैं वो कुछ और क्वेश्चन है, आई विल कम टू दोज क्वेश्चंस, बट आई वांट टू आस्क यू एज a research doctor, as a doctor been in practice for 40 years with so much of knowledge, तो क्या ऐसे symptoms, मतलब people do get car accidents also, they get whiplashes, you know, when they get hit in the car accidents, or they fell. I fell last year on my back, I broke my bones. So क्या ऐसे symptoms जो हैं वो आपको ख्याल रखने चाहिए in your knowledge, in your practice, कि खुदा न खास्ता अगर आपको कोई नेक इंजरी हुई है इस तरह की, दैट इज़ अफेक्टिंग योर ब्लड इनटू द ब्रेन एंड ऑल दैट, तो who to see and what to do at what stage, what are those, you know, certain things that you can advise to our viewers tonight?
Absolutely. Let me start off by falls. It's a very good question. So as the population ages, you'll see a lot of people over the age of 60, 70, etc. One in seven people immediately preceding their death, they fall. So falls are a very common cause of mortality. And what basically happens is that as we growing older, एक term use करूँगा, उसको बोलते हैं sarcopenia. I mean, most of people don't realize what this is. Yeah. So what is happening is that as we are growing older, हमारी वो एक वो है tradition है कि as you grow older, people protect you. कि नहीं थोड़ा सा आराम से बैठे, and you know all that kind of thing.
Cautions.
There is nothing more adverse to your health than doing that. So if you're 70 years old, like I do the same amount of exercise that I was doing 20 years earlier. But it's not something you start immediately. You slowly build it up over time. So if you're 80 years old, you should still be exercising, because what you're trying to do is you prevent your muscles from wasting. That is what sarcopenia is. So sarcopenia causes instability in your gait. So things that would ordinarily not let you fall, but if your muscles are weak, you'll fall. So again, prevention of falls is more important. But then, as you said, sometimes you're in an accident, you have a whiplash injury. What that sometimes does, it's uncommon, but it does it. It injures the arteries to the brain. So it's a stretch injury. Whiplash bolte hain, your neck gets stretched out, it comes back, and you injure your artery. If you injure your artery, wahan pe then a clot forms, and that can go to the brain and cause a stroke. But it's an uncommon cause of stroke. It's not the big one. And unfortunately, most of the times it's missed, because people don't think it's serious enough until that clot causes problems.
Okay. ये मुझे बताइएगा कि जैसे मैं अभी पूछ रहा था कि अगर मिसाल के तौर पे इन योर रूटीन डे टू डे लाइफ you feel like आप नमाज़ पढ़ते हैं, आप सजदे से वापस आते हैं, आप खड़े होते हैं, you start feeling dizzy, you start feeling blackouts, all those kind of things. And generally you are a healthy person. کیا کرنا چاہیے? What people need to do?
So, you shouldn't feel them. If you're a healthy person, then you shouldn't feel them. Basically, it comes back to sarcopenia again. So if you're an older person, as the muscles in your legs, especially the muscles in your calf muscles, which are niche ke jo muscles hai na, these are very important muscles. We call them your peripheral heart. Every time they contract, they push the blood back towards the brain. So if you have strong muscles, then you would not have the lightheadedness. So lightheadedness is happening because when you suddenly stand up, your pressure falls down. And it's more common in people who are hypertensive and on medications. Or you're an older individual. And you don't have to be older also. If you have diabetes and you don't have what's called the autonomic...
But let's say if you had a slip and fall and you have damage, آپ نے lumbar spine اپنی ڈیمیج کر دی تھی at some stage of your life, would that still relate to that problem?
No, it shouldn't. If it's a postural problem, then it's a vascular problem. That means your blood flow to the brain is not getting there in sufficient amount, and it should be investigated. It should never be taken lightly.
تو یہ جو vascular جیسے varicose veins ہو جاتی ہیں, جو vascular issues ہیں, اس کو mitigate کرنے کے لیے when people go to their family doctor, what do they need to tell them? کہ ہمیں کیا کرنا چاہیے for that? What investigations needs to be done?
It's complicated. There's so many causes for it. The first thing the doctor should note and should always note is check your blood pressure lying down and then standing up. So you come to the office, 5 minutes wait ke baad they should check your blood pressure.
Repeat again.
And if you, so let's say 160 over 90, and then you stand up and the pressure falls down to 130 over 60, so that you know exactly what the cause is. So if the doctor has not done that, you should probably ask them, okay, do I have a posture? There's a postural drop in my blood pressure. So that's the first thing. Then in some people, it's probably more common than some people, you have degenerative neck disease. So if a lot of the impulses that go to your brain that gives you an idea of how stable your posture is are coming from your neck. So degenerative neck disease is a fairly common cause of feeling lightheaded or not stable on your feet also. I do feel, I keep on coming back to it again and again, it's your vascular health. If your muscles are good, if your blood pressure is fine, if you can stand up from a sitting position, here's an easy one. Anyone can do that. But do it when there's somebody else around you. Standing up, stand on one foot.
Okay.
And you can find how long can you stand on one foot. If you can only stand for 15-20 seconds, then you know your muscles are very weak and it's causing all these problems. So it's called a 1 foot test.
Strengthen karne ki zarurat hai muscles ko.
Yeah, that's where it comes from. The muscles help your vessels, they help your neck, they help your back. So when we talk about the back, and unless there's a clear sciatica, but it's a chronic back pain, which is the commonest of back pains, those are because all these axial muscles are lax. You're carrying a lot of weight, in the front. Like, I mean, I don't want to make a joke about it, but it's almost like you're pregnant all the time. Like, most of our people, unfortunately, have this big belly. So that's kind of where most muscles are working on, right? It's a totally different thing.
That is one of the generic thing that a lot of people have. Let me ask you this, Dr. Sahib, and I'm saying this from a perspective that in your profession with the neurology, what are some of the tips? मैं चाहता हूँ कि at the end of this session, when we leave tonight, we leave a positive impact to our viewers who are like I said, even we can change one life after this show. That's more than enough. That what are some of those things that you want to say to people that they should need to do this to be safe, to be more proactive, to be more medically fit? And if they have situations, these are some of the tips that I can provide you, and this is what you need to do to move forward in your life. Please.
Yeah. So as I started off by saying, just by being a Southeast Asian is a risk factor for heart disease and stroke.
Okay.
How do you mitigate that? How do you decrease that? Right at the earliest age, you start eating healthy, you exercise regularly, you socialize, you go out, and all those things inhibit or decrease the risk of what's called this chronic subacute inflammation. The inflammation carries on relentlessly over decades, and one of the first features is when you start getting high blood pressure, when you start getting pre-diabetes, and when you start getting diabetes. And I mean, it's not rocket science. If you're obese and your obesity is all in your tummy, हमारा जो है ना, हम छोटे थे, the people used to say it's a sign of wealth, right? The bigger tummy you have. But that's what's the problem. That's all your problems that you mentioned, dizziness and blackouts and, bad arteries, they're all because we're not eating healthy and we're not exercising. We come from a society which over a millennia were malnourished and would walk. We come here and we are in cars, we are eating more than we should be eating. If you want me to say how many lives, we can save hundreds and thousands of lives by prevention. If somebody is having the symptoms, you said it very nicely early at the very start, sudden onset, call the ambulance, they'll take you to the right hospital. Those parts we can do. But that's too late.
Azab, last thing that I want to ask you, it is not your area of expertise, but you as a doctor for so many years. Coronary artery bypass grafting, scabbage, that's something to relate it with the heart and with the cardiologist. اس پہ تھوڑی سی روشنی ڈال دیجئے کہ یہ گرافٹنگ کیا چیز ہوتی ہے, کیسے کی جاتی ہے, اور اس کے آگے ریمیفیکیشنز کیا ہیں ان لائف آفٹر somebody get a bypass done. What do they need to be aware of?
All right, so basically there's two major treatments for the heart is a muscle. The muscle needs blood. It needs oxygen and all the nutrients. So if over time that artery starts getting narrower, the coronary artery, quite frequently what happens is you bleed into that plaque. So the plaque suddenly becomes much bigger because you bled into it, and your arteries are compromised. And so what will happen is that the classic symptoms is that you're short of breath, you get chest pain, you get pain in your arm, on the left arm. Those are very alarming symptoms. You go to the doctor. Most of the times, if it's a localized single lesion, they would put a stent there. So, for example, it's called the anterior descending artery or the left coronary artery, proximal. That's where they put a stent. Our problem in the Southeast Asian population is that our vessels you've got multiple vessels that are diseased, and they're diseased distally, niche, downstream. So the stent doesn't work there because the stent can only work if you've got a small area that you can open up. So what they do then, so they take your vein, it's usually the saphenous vein, and it's a major operation. Like, it's not a joke. It's basically they open your chest, and then depending on how many arteries are diseased, they create a channel. It's a tube between your aorta and after, जहाँ पे उस blockage है ना, उससे आगे जाकर they stitch it up. So what you have to do is what I've been saying all the last half an hour: eat healthy, exercise, and have a positive attitude in life. And of course there are drugs, right? So we talk about what statins बोलते हैं. You've got to bring your cholesterol down, way down. जितना नीचे हो सकता है, it's better. And then you got your blood pressure and diabetes medicine. It's not an easy life. I mean, I have to emphasize again and again that prevention is the key. We haven't even talked about smoking yet, right? So all of those things are working like catalysts, one into the other, causing the heart and the arteries. All those things you will have to do after the bypass. So might as well do it when you're young and prevent the bypass.
ٹھیک ہے ڈاکٹر صاحب, میں آپ کے ٹائم کا بہت مشکور ہوں آج, اور اگر آپ چاہیں تو آئی کین پٹ یور نمبر آن آور چینل. I can say it now, and so people, if they have questions, if you like, you can let me know. We can put it on and people can get in touch with you if they have any questions to ask you.
It's always dangerous to do that because, you know, you don't have the patient's full history.
Yeah,
you don't have their investigations. I would encourage, we have, in Canada, we're very fortunate to have an outstanding healthcare system.
Right.
If you're in Mississauga, the Trillium Hospital has hamare trainees, they've trained with us, they're taking care of the stroke program there. St. Mike is one of the best hospitals in the world for cardiology.
ہمارے ایک اور ڈاکٹر صاحب ہیں, ڈاکٹر محبوب صدیقی صاحب. He does health and wellness show, and I have requested him to reach out to you also and to have him on your show, and so he will be a doctor and doctor both will be talking. I learned a lot today from you, and I look forward having you inshallah some other time again. Thank you so much, very much, for joining me tonight on Voice of Toronto Television. I really hope that the people who are watching us tonight, and we're going to share this to all our social media networks wherever we are watched, and maybe somebody will get that information that they were needing for a long, long time. You look after yourself, sir. Thank you so much for joining.
Thank you for your invitation. I enjoyed your...
I'm very humble. Thank you, sir.
Many thanks.
Bye-bye for now.
Assalamu alaikum.
Assalamu alaikum. Thank you. Viewers, یہ تھے ہمارے ساتھ ڈاکٹر اشفاق شعیب صاحب ایڈمنٹن البرٹا سے. ہی از نیورو اسپیشلسٹ, نیورو ریسرچ پریزیڈنٹ آف آل پاکستانی فزیشنز ان کینیڈا. اور آئی ہوپ کہ جو ہم نے چھوٹی سی ایک ڈسکشن کی ہے, اٹ کم آؤٹ ٹو سم بینیفٹ ٹو آل آف یو. ٹل نیکسٹ ٹائم, اپنا خیال رکھیں. فیڈ بیک کے لیے voiceoftoronto.tv@gmail.com. اور اگر آپ ایڈورٹائز کرنا چاہیں یور بزنس ود اس, یو لائک ٹو بی اے پارٹ آف آور شوز, آپ پروگرام کے بعد مجھ سے رابطہ کر سکتے ہیں 416-786-4881. ٹل نیکسٹ ٹائم, اللہ حافظ, السلام علیکم.